Good morning everyone. Myself Princess Aji. I am BSc Nursing to top Index Medical College. Today my topic is psoriasis. First let's start with the introduction. Psoriasis is a skin disease that causes rashes with itchy, scald, patches and most commonly on the knees, elbow, trunk and scalp. Psoriasis is a common long-term and disease with no cure. It can be painful, interfere with sleep, and it make it hard to concentrate. What is psoriasis? Psoriasis is a skin disease, and skin disease are causes of rashes, itching, scalp, and patches. Most commonly are seen in knees, elbows, and trunk. And second definition of psoriasis. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, and cold. The most common symptoms is a rashes on the skin, but sometimes the rash involves the nails or joint. Psoriasis causes immune system problem. Triggers of include infection system, stress, and cold. And the psoriasis we see the switches and types of psoriasis. Types of psoriasis are pustular psoriasis which cause red and scaly skin with tiny pustules on the thumbs, on hands and the soles of the feet. Word psoriasis which often start in childhood or young altered Generate process which often start in childhood or young adulthood cause small red spots, mainly one of the causes of and limbs. Tigers may be respiratory infection, strep throat, tonsillitis, stress injury to the skin, and taking antimalarial to beta blocker medication. Firstly, pustular psoriasis which has causes in skin by tiny pulses. We see the pulses and the spam to the hands, and inversus psoriasis which make a bright red and shiny lesions that appear the skins and such as the growing to under the breasts. These inversible psoriasis are seen in growing under the breast and shiny lesions of appear in the skin. And erythrodermic psoriasis which causes a fiery redness of the skin and shedding of scars in sheets. It is triggered by severe sunburn infection. Certain medications can stopping some of skin of sheets. It triggers serum infections can certain medication and stopping some kind of psoriasis treatment. The treatments are the sunburn and infection. It needs to be treated immediately because it can lead to a severe illness. And causes of psoriasis are causes. Psoriasis is thought to be an immune system problem that causes skin cells to grow faster, and usually in the most common types of psoriasis known as the plaque psoriasis, it rapid turnover of cells and results in dry scar patches. The causes of psoriasis is fully understood thought to be an immune system problem where infections fighting cells attack healthy skin cells by mistake. Researchers believe in that both genetic and environmental factors play a role in this condition of congenesis. The causes of psoriasis. Psoriasis thought to be immune system problem that causes skin cells to grow faster than usual. It's the most common type of psoriasis known as plaque psoriasis that rapid turnover of cells results in dry scar patches. Psoriasis we can see this dry skins, dry scars patches, and most common plague psoriasis. It's a, and second causes are the causes of psoriasis isn't fully understood. The thought to be an immune system problem where infections fighting cells attack healthy skin cells by mistake. Research believe, research believe that both genetic and environmental factors play a role. The condition is not contagious. Pathophysiologists of the psoriasis poorly controlled psoriasis as atopic dermatitis, cytokinic releases, and from carotenoid systematic inflammation, obesity, and insulin resistance, endothelial dysfunctions, and restoration cardiovascular environment. Psoriasis triggers infections such as strep throat or skin infection, weather, especially cold, dry conditions, and injury to the skin, such such as cut or scrap, a bug bite, or a severe sunburn. Smoking and exposure of second-hand smoke, heavy alcohol consumption, certain medications including the lithium high blood pressures and drug of anti-malarial drug, rapid withdrawal of oral injected corticosteroids. Infections psoriasis triggers are smoking exposures and second smoke, heavy alcohol consumption. Certain medications are including lithium, high blood pressure drugs, and anti-malarial drugs, rapid withdrawal or oral injected corticosteroid, infections such as strep throat and skin infection, weather especially cold dry conditions, and risk factors of psoriasis, family history. We have certain condition in this condition runs in families. Having one a parent with psoriasis increases your risk of getting the disease, and having two parents with psoriasis increases your risk even more. Smoking Smoking tobacco not only increases the risk of psoriasis but also may increase the severity of the diseases. Risk factors are family history, and second is smoking. Smoking tobacco not only increases the risk of psoriasis but also may increase the severity of diseases. Third symptoms are a patchy rashes that varies widely in how it looks from person to person, ragging from spots of dandruff like a skull, swelling of major eruptions over much of the body, rashes of the vary in color, tending to be shades of purple with a gray skull or brown, of black skin, and pink or red with silver skull on white skin. Small, small, small scaling spots, dry, cracked skin that may bleed, itching, burning, soreness, cyclic rashes that flare off for a few weeks or months and soon subside. Dry skin, the symptoms are dry, cracked skin, itching, burning, soreness, cyclic rashes, and patchy rashes varies widely how it looks from person to person. Rashes in berry color, tending white shades, and the symptom diagnosed evaluations of the psoriasis. Physical examination. It is usually easy for your doctor to diagnose psoriasis, especially if you have a plaques on areas such as your scalp, ears, elbow, knee, belly button, nails. Your doctor will give you a fully physical exam and ask if people your family have a psoriasis. Lab test. The doctor might be able to be a biopsy, remove the small spaces of the skin and test to make sure don't have a skin infection. There is no other test to confirm or out the out of psoriasis. The diagnostic evaluations of this evaluations we have seen ears, elbow, knees, belly button, nails, scalp. They have we have seen, and one and only lab test we have seen their diagnostics. Medical management of the psoriasis, steroid creams, moisture of the dry skin, cold tap, common treatment of the scalp psoriasis available in lotion, creams, foams, shampoo, and bath solutions. Vitamin B based cream or ointment, strong kind of order by doctor. Vitamin D is a food and pills of non has non-effect retarded creams. Treatment for moderate to severe psoriasis. Severe psoriasis are treatment of moderate and to severe psoriasis include light therapy, methotrexate, retinoids, cytospin, or radiological treatment, biological treatment. Light therapy, a doctor shines to ultraviolet light on your skin in the slow growth of skin cells. PUVA treatment combines a medicine called Postrane with especially ultraviolet light. The drug can cause bone marrow and liver disease as well as lung problem. So it's an only for severe cases. Doctors closely with patients with light therapy. The treatment of psoriasis light therapy. A doctor shines ultraviolet light on your skin to slow the growth of skin cells. Ultraviolet is a treatment combined medicines called porcelain with a special from ultraviolet light. The drug methotrexate. The drug the drug can cause bone marrow, liver disease of swell, lung problem. So retinoid. These pills, creams from lotions, gels are classes of gels and class of drugs related to vitamin. A retinoid can cause cirrhosis side effects, including the birth defects. So they are not recommended for a woman who are pregnant or planning having children. Cytoplasm, the drug may be suppressor of immune system, may be taken of serious cases and do response to other treatment. It damage so kidney. Cytosporin, the drug may to suppress immune system. It may be taken for a serious case that do not respond and other treatment. It can damage to kidney, raise blood pressure. So your doctor will closely watch your while you take it. Biological treatment does work blocking the part of body immune system. It's an overactive psoriasis. One more time, we have seen in the definitions of we have seen in the introductions of psoriasis. What is psoriasis? Psoriasis is a skin disease that causes a rashes with itchy, scaly patches, most commonly on knee, elbow, trunk, and scalp. The psoriasis have seen in knee, elbow, trunk, and scalp is a chronic psoriasis skin disease that causes the rashes. Okay, introduction we will see. Psoriasis is thought out to be an immune system problem. Triggers include infection, stress, and cold. The most common of symptoms of psoriasis as rashes, rashes to the skin. Sometimes rashes involves the joint or nail. And the psoriasis we have the psoriasis types are psoriasis, gouted psoriasis, inversible psoriasis, ectodermic psoriasis. And the psoriasis causes immune system problem, and psoriasis is the most common type of psoriasis. Plaque psoriasis, a rapid turnover cells result dry scar patches. And pathophysiology and what is psoriasis triggers? Infections such as strep throat and skin infection, certain medications, heavy alcohol consumption, smoking and exposure of second-hand smoke, rapid withdrawal oral injected corticosteroids. The risk factors of psoriasis are family history, or smoking. This condition runs in family. Having one parent with the psoriasis increases your risk of getting the disease. Having two parents of psoriasis increases even more. Smoking tobacco not only increases the risk of psoriasis but also increases severity of diseases. And symptoms are small dry cracked skin and itching, burning of the skin, or soreness, cyclic rashes on flare of flare for few weeks or months. And diagnosis evaluations are lab test or belly button, ears, elbow, knee, and nails. Physical examination we will see, or medical management, steroid creams, moisturize of dry skin, vitamin D based cream or ointment. Preventions of psoriasis: use the moisturizing lotion, take care of your skin and scalp, avoid dry cold weather, use a humidifier, avoid medications that cause the flare ups, and avoid medications that causes of flare ups, avoid scares, cuts, bumps, and infection, get some sun but do not too much, and sap stress. What are the prevention? Using a moisturization lotion and avoid dry and cold weather, use of a humidifier, avoid medications that cause flare-ups, avoid scrubs can burn infection, get sunburn, get some sun but not too much, sap stress. Thank you so much. Thank you so much.